Victorian diseases have never really gone away, but in the last 150 years, I think it's fair to say we've had a huge impact on the number of people who get most of these diseases, particularly the infectious ones, because of a combination of clean water, less overcrowding, having vaccines and having antibiotics. Now, if we think about what's changed among those things, clean water, I think, is still not an issue for most people, but of course, if you're homeless, that can be a real issue. There is more overcrowding because of the cost of living. A lot of people are homeless now, and huge overcrowding in deprived areas and among homeless communities. We've had extraordinary success in the last few decades with vaccines. I mean, if we look globally at how many lives they've saved, and indeed in the UK, it has been extraordinary. But the problem is that we have undoubtedly got fewer people taking them up. And conditions, particularly like, say, measles, are incredibly infectious. And then finally, of course, we've got antibiotics, and there is a real risk of antimicrobial resistance. And in the past, perhaps, we gave out antibiotics much more freely, which resulted in all sorts of other problems. But there is a small risk that you may miss a bacterial infection if you don't give antibiotics in a small number of cases. There's absolutely no question that conditions like measles, mumps, German measles, the reason that we've been seeing increases is because of vaccine hesitancy, particularly with measles and mumps. Well, the first thing you can do is get your vaccines, or get your child's vaccines when they're invited for them. And if you're in doubt, please go and speak to your doctor. You trust them for everything else to do with your child. Why not trust them rather than some random person on TikTok in relation to vaccines? Breastfeeding, of course, offers excellent protection against all sorts of things, including infection in babies. And do know what the really worrying symptoms are. So, for instance, if you've got a child under 5 in particular, who's breathing very fast, they have convulsion, they've got clammy cold skin, or it looks mottled or pale or blotchy, particularly if they have a rash that doesn't fade when you press a glass against them. They won't wake up when you try to wake them up. They feel cold all over, they have very severe shivering, or they've got very severe muscle or tummy pain. Then all of those things really are a cause for concern, along with children who, get up and fall over because they're so dizzy, or they're slurred speech, or they're not passing urine for, I say, maybe 18 hours for older children and 12 hours for younger children. Well, one other thing you can do, of course, is to look at the bigger picture and think about antibiotics. So, please, if your GP says you don't need antibiotics, it's because the national guidance has looked at all the evidence and said you don't need antibiotics. Do follow your healthcare worker's advice if they give you antibiotics. For instance, these days we talk a lot about, can you stop the antibiotics safely before the end of the course? Well, actually, GPs are increasingly giving shorter courses if you need a shorter course. So if they give you a longer course, it's usually because you need it. But do sensible things like making sure you wash your hands, making sure you prepare food hygienically, keep away from other people who are sick, have safer sex. Think seriously about safer sex. We've got a lot of problems with sexually transmitted infections that we thought had pretty much gone away. Do keep your vaccinations up to date. If you're a woman, think very seriously about your rubella, your German measles status. If you're a male, and you're particularly a younger male, then do bear in mind that you may be at risk for mumps, for meningitis. So all of those things are going to make a big difference.